Clinical Services Plan, changes to stroke.
Stroke is one of the 9 services included in our Clinical Services Plan. Our services are fragile and need to change. Our board met in February and decided on the next steps for stroke at Hywel Dda.
What is stroke?
Stroke is a serious life-threatening medical condition that happens when the blood supply to part of the brain is cut off.
Why does stroke need to change?
Currently, there are stroke units at all 4 main hospitals: Bronglais, Glangwili, Prince Philip and Withybush. However, the service fails to meet clinical standards. We do not have 7-day specialist cover, and there are not enough specialist staff to support it. This leads to patient outcomes that are not as good as they could be. Evidence shows that patient outcomes and standards are better if services are brought together and delivered from fewer hospitals. Bringing services together would also help keep and hire staff, making the service more sustainable.
What did the board decide?
Our board chose an alternative idea to combine alternative options 106 and 210 that were suggested by our communities during the consultation as a model to be taken forward for further consideration. This is a new idea that was not included in the consultation process or the assessment of alternative ideas, and will now need further review and testing, as well as engagement with our staff and communities. This idea brings together the stroke rehabilitation unit elements for Bronglais Hospital from option 106 with the 24-hour specialist cover stroke unit at Glangwili from option 210. As part of this proposed idea, all hospitals could continue to provide the initial treatment for stroke before patients are transferred onwards to Glangwili Hospital or the Specialist Thrombectomy Centre. Patients requiring additional rehabilitation in Mid-Wales will be able to receive this from Bronglais Hospital. The merged idea is new and needs careful consideration, detailed business planning and further public engagement.
How will this benefit patients?
We need to do more work to understand the impact of this new idea on our patients. We will be inviting members of our community to share their views with us through an engagement period that will be held later this year before we decide on the final model for stroke services in Hywel Dda.
What happens next?
Over the coming months, we will be assessing this new idea and engaging with you on what it means for patients who use our services in Hywel Dda. We will communicate with our patients and communities about how you can share your views and help further shape the service. It is important to remember that if you or a loved one has a suspected stroke, to call 999 for help. There are no changes to the service at the moment, and you should still access care and support in the same way as you do today.
In short,
we're looking at a new idea for stroke services and need to assess the new combined idea to make sure it meets our requirements. Engage with you to understand your views and how the new idea could impact you. Make sure you dial 999 if you think you or a loved one is having a stroke.
Visit our website to learn more. https://hduhb.nhs.wales/clinical-services-plan/